World Sickle Cell Day 19th June. This International Awareness Day is observed annually on 19th June with the goal to increase public knowledge and an understanding of sickle cell disease and the challenges experienced by patients and their families and caregivers. On 22nd December 2008, the United Nations General Assembly adopted a resolution that recognizes sickle cell disease as a public health problem and one of the world's foremost genetic diseases. The resolution calls for members to raise awareness of sickle cell on June 19th of each year at national and international level. Sickle cell disease is an inherited genetic abnormality of hemoglobin, the oxygen-carrying protein found in red blood cells. Normally, red blood cells are flexible and round, moving easily through your blood vessels. In sickle cell anemia, the red blood cells become rigid and sticky. Red blood cells can live up to 120 days before the body needs to replace them, while sickle cells last only 10 to 20 days, causing anemia because of red blood cells disorder. Also, when sickle cells travel through small blood vessels, they get stuck and clog the blood flow, which can cause pain and other serious problems such as infection, acute chest syndrome, and stroke. Symptoms of sickle cell disease are episodes of pain, swelling of hands and feet, frequent infections, delayed growth or puberty, vision problems. Sickle cell disease is inherited from both parents. Sickle cell trait is inherited from one parent. A simple blood test will tell whether you have sickle cell trait or the disorder. Sickle cell disease can affect anyone, although it predominantly affects people from African and Caribbean backgrounds. Children with sickle cell disease are at increased risk of stroke. The risk is highest between the ages of 2 and 16. People living with sickle cell disease are in the extremely vulnerable group and have to shield during the coronavirus COVID-19 pandemic. The only possible cure for the disorder is bone marrow transplant, but this is only possible for a limited number of affected individuals who have a suitable donor. We can get involved in the noble cause by wearing red on this day and set up a fundraiser to let people in our community know more about sickle cell and help support those living with the disorder.